What if queer teens struggle to get gender-affirming care? Imagine feeling like your true self is hidden behind a wall of confusion and pain. That's what some queer teens face when they can't access the care they need to feel comfortable in their own skin. Gender-affirming care includes medical treatments like puberty blockers and hormone therapy, as well as mental health support. These treatments help young people whose gender identity does not match the sex they were assigned at birth. When teens can't get this care, it can make their gender dysphoria worse. Gender dysphoria is the distress that happens when someone's gender identity doesn't match their physical body. Supporting a teen's gender identity helps reduce this distress and makes them feel more authentic and happy. If a queer teen cannot access gender-affirming care, their mental health can suffer a lot. Studies show that transgender youth are more likely to experience depression, anxiety, and thoughts of suicide than their cisgender peers. Not being able to start puberty blockers or hormone therapy can increase these risks. On the other hand, when teens get access to gender-affirming care, they often see improvements in their mental health. They tend to feel less depressed, less anxious, and more hopeful about their future. Barriers to care include laws that restrict or ban treatments for transgender youth, a lack of healthcare providers who know how to help, discrimination, and family rejection. These obstacles can make teens afraid to seek help, which can lead to feelings of isolation and worsening mental health. Family support is very important. Teens with supportive families are more likely to get the care they need and do better emotionally and physically. When families reject or are unsure about gender-affirming care, teens may face homelessness, substance use, and more mental health struggles. When queer teens can't access gender-affirming care, they may experience increased gender dysphoria, which can cause emotional pain and mental health issues. They might have trouble at school, in social settings, or even with family relationships. Without the right support, they may mistrust healthcare systems or avoid seeking help altogether. Some might even stop treatments that were helping them feel better, which can cause more psychological harm. Creating a safe, supportive environment means advocating for policies that allow access to gender-affirming care. It also means training healthcare providers to be understanding and respectful, and encouraging families to accept and support their teens. This way, queer teens can get the care they need to live healthy, happy lives. Supporting their right to access gender-affirming care is essential for their well-being and future.